Imagine you're driving down the highway. The music is good, the AC is perfect, and everything feels fine. But then, a tiny silent light flickers on your dashboard. You don't hear a crash, you don't see smoke, so you keep driving. This is exactly how heart disease starts. It doesn't always begin with the dramatic Hollywood heart attack, the clutching of the chest and collapsing. It often starts as a whisper, a silent signal your body is sending you, months or even years before the engine fails. Today, we're looking at the strange, silent signs, like the crease on your ear or the fit of your socks, that Western science is finally catching up to.
Hi everyone, welcome back. I'm Dr. Akash, and on this channel, we bridge the gap. We take the latest, cutting-edge data from places like the Mayo Clinic and Harvard, and we overlay it with 5,000 years of time-tested wisdom from Ayurveda. Because sometimes, your body gives you a check engine light that your doctor might miss during a standard checkup. We're going to uncover 4 of them today.
Just a quick reminder before we dive in. I am an Ayurvedic doctor from India, but I am not your doctor right now. This video is for educational purposes. If you notice these signs, don't panic. Just use them as a reason to book that appointment you've been putting off.
Let's start with the weirdest one first. Go to a mirror. Seriously, pause the video if you have to. Look at your earlobe. Is it smooth? Or is there a diagonal crease running at a 45-degree angle backwards? In Western medicine, we call this Frank's sign. It was discovered by Dr. Sanders Frank back in the 70s. It sounds like an old wives' tale, but studies, including research published in the American Journal of Medicine, have found a startling correlation between this little wrinkle and clogged arteries. Why? The theory is that the tiny blood vessels in your earlobe are the terminal end of your circulation. If they are collapsing due to poor blood flow or loss of elasticity, it's a mirror of what's happening in your heart. Now, here is the Ayurvedic aha moment. In Ayurveda, the ear is deeply connected to your kidneys and your adrenals, the seat of your deep vitality, or ojas. When your deep tissues dry out, a condition we call vata aggravation, you lose that juiciness, that structure. A crease here isn't just a wrinkle, it's a sign your internal fluids are drying up. Did it check? Do you see a line? Comment clear or found it down below. It's actually fascinating to see how common this is. While you are still looking in that mirror for the ear crease, look at your eyelids, specifically near the inner corners. Do you see soft, yellowish bumps? We call this xanthelasma. It is literally cholesterol depositing under your skin because your bloodstream is overloaded. In Ayurveda, this is a clear sign that your meda dhatu, your fat tissue, is compromised by ama, or toxins. It tells us your liver is overwhelmed and struggling to process fats. It's not just a cosmetic issue, it's your metabolism waving a yellow flag. Sign number 2 is something you might notice in the kitchen. How hard is it to open that jar of pickles? Or better yet, how strong is your handshake? A massive study published in The Lancet looked at nearly 140,000 people. They found that grip strength was actually a better predictor of cardiovascular death than systolic blood pressure. Let me repeat that. Your hand might tell us more than the blood pressure cuff. If your grip is weak, it often signals frailty, a medical term for a lack of reserve in the tank. In Ayurveda, we view the heart as the root of all prana, the life force that moves through your arms and legs. If the pump is weak, the periphery gets weak. Think of it like a garden hose. If the faucet is barely on, the water doesn't have the pressure to reach the flowers at the back of the garden. Your hands are those flowers. Weak grip equals weak flow. And while you're looking at your hand, take 2 fingers and place them on your wrist right here.
In Western medicine, we call this checking for arrhythmia, an irregular heartbeat that can signal atrial fibrillation. But in Ayurveda, this is nadi pariksha. We aren't just counting beats, we are feeling the quality. Does it glide like a swan, or does it jump erratically like a frog? If your pulse feels like it's skipping beats or fluttering while you're sitting still, that is your electrical system asking for help. Don't ignore the rhythm. I hope you're finding these tips helpful and maybe a little surprising. If you are, do me a favor and hit that like button. It helps get this life-saving info to people who need it. And if you're new, subscribe to join our community of health detectives. Okay, number 3, the sock test. You get home from work, you take off your socks, and there's a deep indented ring around your ankle that stays there for minutes. This is called edema. Basically, your heart is a pump. It has to fight gravity to pull blood from your toes back up to your chest. If the heart muscle is getting lazy or stiff, it can't clear that backlog. The result? Fluid leaks out into the tissues. Ayurveda calls this a kapha imbalance. Kapha is earth and water. When the fire of your digestion and circulation, your agni, gets low, the water element takes over. You get heavy, you get boggy. If you notice that your shoes feel tight by 5 p.m. every day, that is your body waving a red flag. It's saying, hey, the pump isn't keeping up with the flow. The final sign is in your mouth, bleeding gums. Most of us think, oh, I just brushed too hard. But the American Heart Association has noted a link between gum disease and heart disease. Think of your mouth as the front door to your body. If your gums are inflamed, that barrier is broken. Bacteria from your mouth can hitch a ride into your bloodstream and cause inflammation in your arteries. It's a direct highway from the tooth to the ticker. This is why Ayurveda is obsessed with the tongue. We've been using tongue scraping, jihva prakshalana, for thousands of years, not just for fresh breath, but to reduce the bacterial load that burdens the heart. If your gums are red and angry, your heart might be stressed too.
So let's recap your checklist. 1. The ear. Check for that diagonal crease. 2. The hand. Test your grip strength. 3. The leg. Watch for that sock line. And 4. The mouth. Look for bleeding gums. If you have these signs, don't panic, but do act. From the Western side, get your blood pressure and cholesterol checked. From the Ayurvedic side, keep your circulation moving. Walk daily. Eat warm, light foods to reduce that heavy kapha. And maybe start scraping your tongue. Your body is always talking to you. You just have to learn the language. If you want to know what foods strengthen the heart's ojas, check out this video right here. I'll see you there. Stay healthy.